Well, welcome everyone. We have a hybrid environment going on today. So I think I'm looking that way and I'm looking this way, but we'll get there. So welcome. Thank you for joining us today on this partnered, good morning. We have more coming in on this partnered lecture today around suicide prevention and financial wellness. I'm Tina Atherall. I'm the CEO at PsychArmor. This is my partner here at STEP, Kathi. You'll meet her in just a second. What I would love is those of you that are online, those of you that are coming into the room, we'll do a query in just a second, but those of you that are online, I would love to hear what is your current work. Are you working military aligned? Are you within mental health? Are you in government? Are you in community-based organizations? Are you a family member? None of the above, et cetera. Because this topic is meant to be very broad for entire community members, there'll be different places, especially at the point that I get to with crisis response plan, where we'll say, well, if you're a mental health provider, it might look like this, but if you're a community member, it might look like this. So it'll just be super helpful to hear. And then maybe we could even have our co-facilitators online give us an idea of who's in the room. So welcome in the room here in San Diego. I know that we have an individual here from telehealth and Talkspace. Do you mind just sharing real quick where you're coming in from? And that helps. Great. Excellent. Excellent. Thank you. So we have government here in the room. Okay. And as they flow in, maybe we'll do more of a query. So for those of you that are not familiar with PsychArmor, I know our friend Tyler already has said, hey, we use your stuff. But those of you online, I hope you know about PsychArmor. We have over 250 military cultural education products online for a variety of different audiences. We always start with culture first. And again, our population is the military connected. So we believe strongly in understanding who it is that we serve and helping those understand the military connected community as well. What's important to know is that we always started around the online asynchronous material so that you could utilize the material anytime, anywhere. But like in situations like this, we take from that asynchronous material and build upon that so that we can do live trainings. We work a lot with organizations on their internal strategies around training. And then, of course, we do custom courses for our partners in ways that are helpful for them around working with the military community, and then also licensing to our friends that have bigger systems that need our courses on a wider net. Good morning and welcome. So that's a little bit about PsychArmor, which is why this partnership with STEP has been so incredible, because we know that there is more beyond our coursework in terms of just talking about suicide prevention. We want to look at the entire public health approach and look at those areas where there might be critical people working in areas like financial wellness that could utilize the education that we have around suicide prevention strategies in those times of need. So that's where we will blend our time together.
Thank you. So, anybody know what all of these things have in common? Any ideas? All of them can be affected by your financial situation. And there's more. This is just a few of them. If you're worried about money, you're not sleeping very well at night, right? There's a significant percentage of people who are experiencing suicidal ideation who have had a financial crisis within the 24 hours prior. This is new information that has been coming out. It's research that's being developed as we go, that's showing the relationship between all of these really very life impacting issues and financial situation. And so that's the sort of the foundation of the work that we do. We're starting usually with somebody who's in a state of financial crisis and helping them build a plan to end up in a state of financial well-being. Why do enlisted military people end up in financial crisis? Well, the first reason is because most of them are Americans. So the bottom line is, most Americans cannot come up with $400 to deal with the financial crisis. You blow a tire, it's $400 because you got to replace two, right? And now what? You don't have the money. So you take it from some other critical basic need thing and apply it to your tires because you got to have your car, you got to be able to get to and from work. Now you don't have groceries. Well, you got to feed your kids. So you take the money from your rent money, you're going to figure it out. You'll get the rent money. It's not due today. You figure it out and you apply that to the groceries. Then it's time for the rent to come due and money did not materialize out of nowhere. So now you're up against, you don't have the money for rent and you have a 3-day pay or quit notice. It just can spiral just like that. Not just for military people, not just for veterans, but for Americans, period. It's a lot about how we live and what we know about finances that that puts all of us in that situation. Then you take a subset of those American people and you put them in the military and you send them off to basic training far away from any of their support systems or resources, and you ask them to make it work financially without giving them any extra training or experience or knowledge base on how to manage their finances. Then about every 3 years, you have a move from one place to another. Those moves create an increasing amount of spousal unemployment or underemployment. We know that that military spouses have one of the highest unemployment or underemployment rates in America. And this creates situations of housing insecurity and food insecurity. And it's all sort of created by their volunteering to step up and defend our nation. So we believe that we have to support them. We have to help them get what they need in order to live the rest of their life with a state of financial security. We've learned that there's a bidirectional relationship between financial challenges and mental and physical health. More and more research is coming out on this. And as your financial situation gets worse, you're more likely to be more depressed, have a higher level of anxiety, be sleep disturbances, and be facing all that whole array of things that I showed on that very first slide. As those things increase, you make worse decisions, your financial situation worsens, you gamble, not necessarily, I'm not talking about necessarily gambling, but you gamble with how am I going to allocate this money? Because you're not making the best possible decisions because you're stressed out, you're depressed, you're tired, right? And it just keeps spiraling, right? It goes back and forth. The one layers on top of the other and it keeps growing until it's worse and worse.
This is my part.
This is your part.
Okay. But I'm going to add now on to something with yours just because I'm going to make the connection here.
Thank you.
Yeah. So first of all, Jenna, is there anybody that's online that happens to be in the financial industry at all? Is there anyone that's working, and I'd even say county-wise, like is it case management, anything around services? Is that partly where you sit at all, or is it behavioral health?
It's
Great. Around behavioral health. Okay, great. All right. Anybody?
case management, no one really financial.
Okay. Okay, great. Program management, case management. So case management could also be then resourcing to the financial. Okay. So before I get to the suicide risks, back on the slide that she presented, like what do all these things have in common? And they have an outcome based on financial stressors. One of the things around food insecurity that we've been paying attention to, and one of our reasons why at PsychArmor we're very interested and have been pushing this relationship with STEP is because in our beginning of understanding and partnering, there was a conversation around diaper drives, right? Like they get diapers to families, military families in the area. For the fun of it, start Googling a thing around diaper insecurity. And at the end of diaper insecurity is that families are unable to send their children to childcare because they do not have diapers for their children. Imagine how this affects a military family member, where there's another layer around childcare and access to childcare. And everything that she mentioned around spouse unemployment or underemployment, then also the military member, that it's not an option not to go to work, right? So around diaper insecurity, to have those areas where they actually can receive diapers is beyond just they need diapers. It is a financial wellness and health, and actually a critical need for family members. And so there's a lot of things that hide underneath that. So we're going to switch over to the gear now on suicide risk factors. And you may see some things on here that could correlate or intersect with the slide that Kathi showed before. One of the things she had on there was shame. Let's draw a line over here to humiliation. Think about those areas where all of us at one time or another have probably had that situation where, uh-oh, things are tight. Or as we all talk about gas costs and grocery costs, we know how that completely shifts our finances. But what might that look like also for a military individual based on many of the characteristics that we know around their culture? But these are the things that we talk about around risk factors, suicide risk factors within our military community. And of course, adjacent to this would be our strengths, right? And the strengths around our military community and others. But obviously, here are these things around, is there an intent and plan? That's a really big thing for us to look at. Those of you that are working in the mental health space, you've had training around this. You might be working in case management or other community services. So those areas that we say, listen to that. And it might come at that place of a financial crisis. Access to lethal means. I'm going to talk about this more in just a minute, but there's a large education point around understanding that our military community has firearms, which is considered a lethal means. And how does that increase suicide risk and our prevention strategies, especially when there might be a point in time where there's a crisis? And right now we're talking about financial crisis. So prior attempts in family history, of course, this is looking at the individual, their background, what are some of the risk factors just related by their biopsycho and social things. Mental health symptoms, substance abuse, we know is oftentimes risk factors for suicide, and of course is at higher numbers in our military community than their civilian counterparts. Extreme stressors, let's put on here also financial, which is what we're talking about today. Here's financial insecurity, medical issues or pain, which again, we would love to do a whole nother section around pain and pain management as it relates to the correlation with suicide risk factors, but I could go on and on with that. So again, let's put ourselves around our active duty service members. And this is the point where I would love to be able to have conversations with all of you more so than just discussing this. But I think especially since we have county here, we have somebody here from Talkspace in the room. We know what they're doing is that they have services that are meant for large population, but what do they know about their active duty service members and also the veteran population? And the main thing that we want to drive home is what is commonly known is that the risk factors and the suicide numbers are higher in both of these populations than in their civilian counterparts. And we've given you the numbers here, more than twice their non-veteran rate. Female veterans are an area of increased concern as the numbers continue to go much higher than their civilian counterparts. And what we don't have here is talking about our family members. And that could be the spouse, children, or even caregivers that are also aligned. And of course, the numbers are higher in that demographic. So why is this? Why are there specific risk factors for the military? Obviously, occupational. Right? Occupational hazards, military experience contributes to that. But what we also want to raise attention to is it's not necessarily did they deploy, but the experience itself. What is tied around being a part of a military community and then during transition, not being a part of that, or being a part of the military community? What does that look like for you that might create stressors, as Kathi has already stated before? That could be the financial part. Again, deployment, operational tempo, transition to civilian life and injury. All of those things are critical to understanding the person that you're serving, whether that's as behavioral health, case management, or even a family member. Understanding that these things that are very unique to our military community are things that can contribute to crisis and risk related to suicide. Talked about stigma a lot, that asking for help. We come from a community that's very, very honorable in a team, not the I, and asking for help can often be a challenge. Also noting that when you're active duty, you are operating, right? And so there's many reasons as to why there's also that, but we're not going to dig too much into that into this conversation. I've already referenced use of firearms, 72% of veterans and 70% of active duty service members. And when we talk about lethal means, we want to talk about what we do around that conversation around firearm safety, and how do we, when we're working with a military member or veteran, what are those conversations that we have around that to help in terms of reducing that risk of suicide related to firearms. Again, a whole nother part of our training. So I've talked about some of this already. Now, let's just go to one real quick thing around some of the myths that are around suicide. And again, if I could see everyone online, how many times have people heard, like, if you ask if somebody is thinking about taking their life, that you're going to encourage them to take their life? That's a myth. And we want to talk about that in a very honest and candid way with anybody who, we all have individuals in our lives that may be struggling. And asking that question and then knowing what to do after that is very, very important. So the myth is that by asking that you can't change if they already have suicidal ideation or if they have an intent, that you can't change it, you can. And so we highly encourage people to get comfortable with that. Oftentimes when we're working with healthcare providers, we go through a training that does just that, to really work on the experiential asking the question and then how to follow up. And then there are appropriate assessments for suicide risk and safety plans, which we're going to talk about today. And that is our crisis response plan. Could you just give a query on how many people online, anybody here already do crisis response plan as a part of their work, or have they been familiar with it in the past? Have a yes. Okay. So for those of you that work in mental health and behavioral health, we got a lot of them. We've got hands raised. Okay, great. So this is going to be something that they've already worked on. Why are we pairing this with financial wellness? And why is this something that we wanted to bring to you all today? Because if you're not in that embedded behavioral health or healthcare team that's already doing this and feels comfortable with it, if you're in case management and somebody comes in with a financial risk, we want you to start to have a knowledge and understanding that there are tools out there, there are strategies that you can use, even in that moment, to work with your clients, your members, and your patients. With tools that we know have a very strong fidelity and evidence that it does work. The counter to this is those of you that work in behavioral health may know about something called a safety contract or a suicide contract. And the evidence does not support that is as effective as a crisis response plan or this type of planning. Perhaps why? I highly encourage you to look at the work of Dr. Craig Bryant. He is our expert that does all of our training, but he also has, oh my gosh, you could go down the rabbit hole. So much research and literature reviews that are out there that support not only why does the crisis response plan work, but there are very, very specific and key ways in which you utilize it that are critical to also making sure that you're supporting the individual that you're supporting through a crisis response plan. And something as simple as, why do we do it on an index card, which I'm going to get to that in just a second. So this is really a strategy and a tool to help an individual identify what are their strengths. So we just talked about all these risks, but this is like a strengths builder in a time when someone is not in crisis, so that they can reach to that when they are in a crisis and empower and remind themselves that they do have the tools that they need in that moment. Because and again, if we dive into this further, there's a suicidal mode, which is what this is based off of. And that is that our brain might not be working and firing exactly as it needs to in that crisis moment. I could make a lateral to thinking about what that must look like for an individual that has to step into Kathy's office or that team at STEP. What that might feel like in terms of that moment of crisis. So we're hoping actually that the crisis response plan will include STEP as one of those places that they'll call in case, or even you as a practitioner, if there is that moment of financial stress. So we believe in the crisis response plan. There is tremendous research that's out there to support it. It is a tool and a strategy that we want you to get comfortable with today. And I think we're good on time. How much time do I have? Okay. We're purposely going to walk you through it so that you can just get have some comfortability with it. For those of you that are online that have already done that, that's great. Let's keep practicing that muscle and that skill. And let's walk through what's a part of this CRP, this crisis response plan. Now, caveat to this, depending on who you are and what your role is with an individual is going to be how you work through this plan. Again, if you're a behavioral health team working with someone who has had high risk for suicide, you have a very specific relationship and moment with that individual. What we want people to get comfortable with, again, is that no matter what your role is, there is a way that you could implement this with somebody that you're working with that could be beneficial down the road. So we're going to ask that you do your crisis response plan today for, guess what? You. And let me share something that in our work doing this, and our main clinician is Dr. Heidi Kraft. And many times I'm like, I wish you could have had the Heidi Kraft thing today because she's phenomenal. But when she started working through this and we were doing the crisis response plan as a part of our other work, she would come back and give us some really key things that I found super interesting. And that was that as she was working with healthcare providers and behavioral health providers and doing these crisis response plans as a mock, like, but let's do it for you. There were individuals in that room who really needed that plan for themselves. So I encourage you that although this is an activity and an exercise, dig into it. Think about it. Think about how this feels for you to be developing this plan, because the more that you can be comfortable with it for yourself, the better you're also going to be for that person that you're working through this plan with. So you all have an index card. Those of you online, grab a piece of paper. The index card, and this is what I love about following Dr. Bryant's work, is that the index card is meant not to be your form at your agency. So San Diego County, don't make your own form. Make this a personalized index card. It's something that can be tucked away in a pocket. It can be tucked away in your wallet. It can be tucked away, but it's also yours. It's not the County of San Diego's. It's not PsychArmor's. It's not branded somebody else. It's empowering the individual to say, it's mine. There's a couple different ways that you can do it, but putting it in, do I have this on the next one? Yeah, here's your quadrants. So you have areas of warning signs, strategies, sources of social support, reasons for living, 2 big clunks, and emergencies. So what I want you to first do, how am I doing time? Because I just want to make sure I give enough. Okay. What I want you to first think about is warning signs. What are those moments? And again, understanding that this is developed and built for individuals at that time that have had, that crisis at risk. But again, why I love this is we all have those times where we're on that edge and we're stressed out. What does that look like for you? Do you get tired? Do you cry? Are you drinking? We give you some examples here. So take just a few minutes, jot down your own. This is your time, your card. Jot down, what are those warning signs that start to tell you, oof, I'm a little bit on the edge here. I'd love, like, if Kathi was to give some, like, how's that show up financially? Is it, do they spend more? Is there, and you should, yeah.
Some of them will spend more, like, just try to
hold it.
But and not pay their bills.
Yeah.
Because they're afraid if they let go of it, they'll run out.
Yeah. Actually, do you mind coming up here? Because I think that's how I'd like to tie some of this into is like she wanted to come up. So since we're trying to create this as adjacent, like what are some of those things that you do see? I remember you telling a story once and you're like, what created this urgency for you to come in now? And basically the house is falling.
Yes.
So do you want to share that? And I think that's an interesting thing for warning signs.
Yeah. So that's one of the questions that we ask people is what caused them to come in at this moment. And there's all kinds of different things that they'll say. My husband and I started talking about divorce, or we're fighting all the time. When on payday, I'm never feeling happy. On payday, my stress level hits the maximum it could possibly get to, because I know that I don't have enough money coming in to pay all the bills that I need to pay this payday. And I don't know where we're going to get the groceries for the next week. Do you know that the difference between diaper security and diaper insecurity is about 30 diapers?
Wow.
So families who are struggling, who don't have enough diapers to get through the month, only need about 30 diapers to get through the end of the month. And it seems like that would be such an easy thing to come up with, but it isn't. Diapers are pricey, and so it can be the difference.
Yeah. Yeah. So that's one of the reasons why I wanted to integrate this too with you, because I think, look at what we have listed here. but we didn't list anything around financial. And we also think about gambling. We know that that is obviously a large area of concern. We don't have it on our warning signs. We want to start integrating some of these things around the finances. So what are some of your strategies for managing stress? What do you do? We gave you some good examples here. Write that down on your card. And again, this is supposed to be that point of reference that when things start to get out of control, you can remind yourself that there are things and tools that you have that you have used before that you can get back to. So my question for you to think about is, what works for you? What do you do that can lower those moments of stress and create some sort of equilibrium in your life? Are you going to say something?
One of the things that I think is important about this, if you look at it, some of this stuff is, it's not like, oh my gosh, I'm feeling really stressed right now, I better go walk the dog. But instead it's, if I walk my dog every single day, my stress level doesn't escalate as quickly, or I just don't get as stressed out as I would if I don't walk my dog every day.
Yeah.
So I think it's both, right? You want to use it preventatively. You want some preventative things that you can do. These are things that I do to care about me every day or as often as I can. And then also some things like, I feel it coming on. I'm feeling these triggers. Suddenly I haven't slept for the last 3 nights. Now I need something that I can do to bring my stress down right now. Now maybe I'm going to call Uncle Bob. Oh, my sponsor, Bob.
Yeah, which is the sources of social support. And thanks for leading to that. So we know that isolation can be an extreme risk factor in a mental health period. And so for me, the counter to that is the strength around who is in your social support. We do a lot of diving into this around, and what happens when you're working with someone and they say they have no one. So if you follow some of the previous work of our Surgeon General from Vivek Murthy, talks a lot around people will say they don't, when asked, if you have someone to call in the moment of emergency, how many do you have? And it's 0 to 1, right? So we ask you this question right now, write down who are your sources of social support. My other question would be, if you don't have anyone to write on your card, that would be a thing to start to look at. That should be a concern. Who do you have that you can call in those moments? And if you can't access that, then that would be something that we would want to work on together. One, if you're that individual that's sitting with someone working through the crisis response plan, but it's also a great reflection to say social supports are critical. Without social supports, we lack connection, we're isolated, and that adds a sincere risk to us. So who are those people that you can call and text? So just offer for you to write that down. You can see some things here. I hope many of you have group texts that provide even funny memes during the day. Like, that's my source of social support sometime, and it's friends all over the country, and you know who you are. If you know, you know. But I'll tell you what, there's a lot of some first drafts of things that we wouldn't normally say that happen in those text messages. And so just really thinking deep about what those social supports look like. Reasons for living. Wow. There's a lot of great work around that area and working with individuals, in particular, just larger communities too, about recognizing like that key factor of hope. Dr. Bryan talks a lot around optimism being a strength, and optimism of knowing that tomorrow could be a better day. We're working and continuing to work more. I look at Jenna because she knows our faith-based community is a great place. When we look at some of the risk factors around moral injury, your faith-based community is going to be such a great place to lean to. So what are your reasons for living? I just watched my daughter walk down the aisle this weekend. That's a great reason to live. Do we think about that? Do we think about the alternative? What if we're not there to see that happen? And so finally, in emergency, yeah, please.
One of the things that
Come closer so they can hear you.
One of the things that Heidi always says is it is purposeful that there are two boxes for reasons for living. That is intentional, because we need to have as long of a list as possible. If one of those areas gets weaker, we still have a lot of other stuff that we can turn to that could help us remember why we're living. And the first thing we do at STEP when somebody comes in a state of financial crisis or that they're just at the end of their rope with it, because one of the things we've learned is ongoing chronic financial stress is as bad as an immediate moment as far as the impact that it can have on somebody. So when they come in at that point, our number one goal, the first thing that we try to do is restore hope. You can overcome this problem. We are not going to stop working with you until you do. We're there for you. We're not going anywhere, and you've got this. And that's why this is huge, that there's two of these. Restoring that hope is paramount.
Yeah, thanks for adding that. Aw. Now I know for the 2 boxes. I don't think those 2 boxes are in our course, by the way. I think we need to add the 2 boxes. Anyway, so if you watch the course, add the second box because Dr. Kraft says so. In case of emergency, your doctor. This is also if you need to hand that card to somebody else and make sure that they make that phone call for you. We encourage you to have the new 988 line, 911. I'd also say there's some great things out there around the teleworld. So there's crisis text lines as well. We know that there is great engagement around being able to text somebody. So we don't have that in there, but who are your people in emergency? So I was walking my kids through this. And part of my motivation around that is because my kids have been critical community members for their own friends. So I wanted them to understand how to do this so that this could be something instead of maybe some of the other assessment tools that are out there, actually like they do with fentanyl test strips. There's a plan around kids carrying them, right? So I worked this through with him. The best thing was when he got to emergency, he's like, I don't know who my doctor is. And I was like, okay, let's get you the at least the scripts number, right? So it can also be helpful because then they know who their doctor is. So this is the crisis response plan. So just everyone, if you've done this, if you've taken a look at it, just reflect on it, you've built your plan. And again, the purpose around this is that maybe in that moment when you are unable to make that clear decision that you have a plan, you have one. Here it is. Pull it out and remind yourselves. Let me just see. Okay, there is hope. So can I pause? Do I have time? I didn't wear my watch. Okay. I'd love some feedback. And if people write in the chat, especially case managers, is this anything that case managers at the time of financial crisis, if they see a financial crisis, would consider doing any type of planning like this? No. Oh, okay. Yeah. I'll ask that, and maybe that's just, a great place where we think about who also has these type of tools that they can work on with their individuals that they're serving, because it does have, well, your team does your team do CRP? Yeah. I don't know if you want to add anything to that. Well, you already said they did, but you know what I meant. Yeah.
Yeah, I think that's good.
Yeah. Anything in chat? Oh, go ahead, Tyler, please.
Getting comfortable being proactive and maybe peeling back that next layer of the onion. It doesn't hurt to ask because the individual may want to further explore it. It's the stigma that we as providers, or resources, find ourselves in, like, where is their boundary when it comes to suicide prevention? I don't think there is a boundary, because you don't know what that line is until you've reached that access point.
Yeah.
I think one of the things, go ahead.
Oh, it's getting comfortable with it and the familiarity with it so that you might not think to ask that question, especially you said like amongst either behavioral health, but also comrades, did you say? Yeah, that you might not have the familiarity with it. And so just knowing that it is appropriate to cross over that line, and that this is, I think there's a lot that Dr. Bryant talks about the assessment part of this. This too is an assessment tool for me. When I honed in on the social supports. If I'm unable to write down, that's like huge. That's a great place to motivate. We were talking about solution-focused therapy, which is basically the solution-focused work is what they do at STEP. And it really is that element of looking forward. Well, how do we build that social support up further for you so that this plan can be complete? Yeah. Go ahead, sorry.
I think that's a really good point about being confident and familiar with having these conversations. If we don't practice this, when it's critical and we need to be able to talk to folks about it, we're going to stumble over our words. It's going to be evident to the person that we're talking to that we're not comfortable, which is going to make them want to try to take care of us rather than themselves. And in this moment, they're in a critical situation. So I need to be confident and calm, and I need to be non-judgmental, and I need all of that to emanate off of me because I'm so comfortable talking about this that it doesn't come off any other way. So I strongly, if you don't already practice something like this, I cannot support you strongly enough in do some role plays. Get a coworker who can see the value of this to sit with you and one of you be the client and the other one the case manager, and then flip the roles and do it until you can sit in front of somebody who is in crisis or who you think you're seeing some signs that they're headed that direction, and you can be confident and comfortable just walking through this. It maybe takes about 10 minutes. It doesn't take a long period of time. And if 10 minutes, if it changes the trajectory, man living, that's so worth it.
Yeah.
That's the best 10 minutes you ever spent.
Yeah. The reasons for living just made me think about something too. We often talk about values or even the cultural values within the military community, but reasons for living, when you have to sit and think about that, it really is thinking about the values, your own personal values. And how often do we sit and reflect upon that and see that as, once again, this crisis response plan is developing strengths and strategies to see our next word, hope, which I'm going to go to that. But I think you have a question.
Yeah, and someone asked, has anyone studied financial social work? I know that.
Oh, that's this
Yes.
model.
And talk a little bit about that and just repeat the question.
Yeah. Repeat your question. Okay, so the question was, have we ever looked at financial social work? So I'm going to dig in on this just real quick before really the queen of financial social work. So for me as a social worker, this knowing that they did financial social work as their change theory at STEP was what for me was critical, because we know that there are many layers in the way that social workers look, not only from a systems level, but we also look at all the other, well, that is systems, all the things that might influence a person's inability to have financial success, period. And if you look at those things within the military community, it goes far beyond, did you do your spreadsheet and your budget well? I'm a military family member from years ago, and finances were always the most critical thing for us. And our offer was learn how to do a budget sheet. That was not what our issue was. And so at STEP, this is my handoff, the financial social work, and for the person that asked that question, we've actually taken that to government and said, maybe instead of doing budget sheets, we should do a behavioral change model, which is the financial social work model. So we love it. So we want to talk about how you brought that in?
Sure. So all of our social workers who do it, which all of whom do the work directly with veterans and or service members that come to us for support, are all, number one, we all have a CPFC, certified personal finance counselor, which gives us, some knowledge base and about like basic financial rules sort of living. But then we wanted more than that because we're social workers first. And this finance thing was kind of an add-on that we started long before the Rita Wishton, I can't say her name correctly, started that founded the Financial Social Work Institute. She has that, it is open. You don't have to be a social worker to go through that program. It's a great program for helping you to help folks understand their relationship with money. I was just telling Tina this morning about my a very recent client family that I worked with where one spouse, their thing was, we have to save money because we have to have money in case of an emergency to be able to help ourselves out so that because we don't want to have to go borrow money to fix something. And the other spouse opinion was, money is made to be spent. We can have a rich life now doing the things we want to do if we're not hoarding up our money in case something goes wrong, right? And so with those two very diverse approaches to money, it's a challenge for those two folks to be able to talk with each other. It increases financial stress in the relationship. And we already know that it's a very large factor in divorces. It's the most frequent thing that couples argue about is money. And this program helps you to sort of dig down a little bit and understand a little bit about where each person, each decision maker in the family is coming from with their thoughts and their relationship with money. It's really very helpful. It also points out some key laws that are relevant, not just among military people, but some that are. And like the military, what is that? I can't even think of the names of them right now. I'm so sorry. I left my notes in my office and I'm totally discombobulated. But there's the SICRA and some of the things that are very specifically for military families.
Anything?
Can you talk at all about the MFLCs and for
Oh.
personal financial counselors for active duty families, any resources on basis or side?
Okay, so for the MFLACs or the personal financial counselors, and there's all of the armed services obviously have their Army Relief, Navy Marine Corps Relief Society. So is that question about the resources that they can get to support their work or resourcing to MFLACs and personal financial counselors? A little bit of both. Okay, so one of the things that we would want to frame is to say, if you're not aware, especially like San Diego County, if you are working in an area that is not specifically related to the military and there is a financial type situation, one, no step, that's it. But also understanding that there is a system that can support the military individual that's active duty. Veterans are very different. So that's where you're going to look to the community and what community programs are out there. And then also understanding what's at the VA, but understanding that there is a larger system that is wrapped around these individuals and their families is key. At PsychArmor, we seek to provide those resources to you or for you through our courses and training, and also having strategic partnerships like this with STEP. MFLACs, I think, are an absolute critical piece in this, and this is why we would love to see that MFLACs actually are trained on CRP and financial wellness together, because we know that they are the closest connection to our military family members while they're active duty and coming in and out of different communities. So one, understanding that they're there and that's a resource to pull to if you're a community member or whatnot, but then also for that MFLAC community to understand that there are other resources for them to utilize, like our training and like STEP. Do you work at all with MFLACs?
Yes.
Yeah.
So probably about 70% of our referrals come from
There you go.
commands, MFLACs, the finance counselors, the unit or command finance counselors. So we get a lot of referrals from the base because there is plenty of room for everybody to help these folks. There's no, like, we don't find ourselves in competition with anybody. There's no point in it, right? So we work with them. There's been many times when Navy Marine Corps Relief Society called me up directly and said, hey, this family needs, this much money to put an engine in their car. We can do this much. Can you guys do the rest? And also, so Navy Marine Corps Relief Society comes in, they do the loan, they give them a plan, and then they're done.
Yeah.
We follow up for 12 months after the intervention. So we contact the clients at 1 month, 2 months, 3 months, 6 months, and 12 months. And just check in with them, because we'll call them at 60 days and say, okay, so your goal was you were going to put $50 a month in your savings account. How did that go? Well, we didn't do it. Okay, did you put anything in the savings account? Well, we did it the first month, but this month we didn't do it. Wow, how did you do it the first month? How did that work out for you? See, this is solution focus. I'm not saying, well, why didn't you get it done, right? How were you able to get that $50 in there the first month? And is it still in there? It is? Wow. So you put it in there and you kept it in there all this time. How were you able to do that? What stopped you from taking it out and using it some other way? I know you guys are tight with your finances right now, right? So we're going to stick around and help. We're cheerlead and support and encourage. And sometimes the goal needs to be adjusted. Maybe the goal wasn't the right goal to start with. And so we got to work on that.
Yeah.
But we're going to stick with them, because if you think about it, this is my best analogy for this. How many of you have gone to a workshop where they were going to help you organize your office? And you learn so many great things about organizing your office. You're going to get these folders. You're going to have those stackers. You're going to have the vertical ones. You're going to have your file drawers changed around. Man, this is going to be powerful. You're going to be so much more productive once you get your office organized, like you just learned at that cool workshop, right? And you go back to your office and you got all your workshop materials under your arm, and you're heading in there and the phone's ringing. So you grab that phone and you set those materials down and you take care of that thing. And then you, while you were on the phone, of course, you turned your computer on, and now you see all those emails that you missed while you were out. And you're starting to work on some of those emails, and you need to push that stuff off your desk because you need a little workspace. So you push it over to the side. And the next thing you know, you're not doing anything with that workshop. Well, that's a behavioral change workshop, right? How to get your space organized. That's a behavioral change workshop. And we don't want that to happen with the people who put in all the time and the effort and the work with us to develop their plan for their financial future. We don't want them to go back home to hang up from us and then just not, set all the materials to the side to gather dust. So that's why we stay in touch with them. They don't have to answer the phone, but most of them do. And we stay in touch with them and if they want to go more than 12 months, every once in a while we'll have somebody say, well, what do I have to do for you guys to call me back next month? Well, you just did it. We'll call you back next month.
Yeah. So it's that long-term support, and not in a time of crisis, which is kind of like the CRP is for that as well. Not at the time of a crisis, build it before, use it when you need it. But so for all of, if there's MFlex here, we know that work around the finances and that true critical behavior change, your relationship with money, and your ability to talk about money and really lean into it in a different way. You had said having money power you is suicide prevention. And so people will say, wait a second here, everyone's talking about suicide prevention and then talking about like the courses we do, Save or whatnot. That's not it. We know that it's this work that's it. And creating financial health is suicide prevention for the long term, right? We recently worked on some work where we wanted to work with military youth, because what happens when there's chronic financial stress in families? Mental health outcomes are extremely adverse for children. We'll look at ACEs, right? Around that financial piece. What better of a way to conquer this early than to start to do some of this work in families, which also are our future military, as we know that military families recruit their own. So, all right, what is our last slide? Oh, is there any other questions?
There was a comment about using this in non-clinical settings.
Yes.
But I think we covered most of that, but if you have anything else to add there.
Yeah, my anything else to add to this is like kind of where I started to say, like, we really talk about how this is built and why it was built and why we know that the CRP part works. This is where I would hope that people were comfortable with it. I do values workshops. And if I was to say to you what our values workshops looks like, it's exactly this, but it's what lights your lantern and how do you protect the flame? It's the exact same work. And it's meant to just say, I know what I might not even know what I have, but working through this to find out what are the great things that you do have in your life, so that in that moment of crisis, which to us may be that financial piece, that you have already done the work to look at, I have these things built around me. My hope would be that in the work that we do around, if you're a clinician and you're sitting with this member, you actually do this as a part of your own planning, just like you would an emergency plan if there's an earthquake type of deal, which I know, raise my hand, haven't done that, don't have enough water. So probably need to take my own advice, but that's my number one thing. We want everyone to get comfortable with this. I think Tyler also backed that up in the audience. Anything else you want to say on that? So we left this QR code because this will direct you right to specific courses that we talk about, like why is financial health financial wellness, right, before the crisis, so important, and or understanding that if you have somebody that is sitting in front of you that's also not talking about their financial health, that should be like ding, 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 like what do we need to dive into? And understanding those things that lie under the surface that might create the inability to talk about your finances. What is it? Those are the things we don't talk about at our dinner table. However, it might very well need to be those things that we talk about at our dinner table. So I don't know if that's a good place to close. All right. So those of you that were online, thank you for walking through a little bit of our tech issues. Hope for those of you that have done the CRP before, it was a good time just to revisit it. Appreciate everyone who joined, and that for our audience too that came out to visit us. So we'll close out. We can do some more one-to-one. All right. Do I need to do anything here? Ciao. All right. Morning.